I'm Cathy Obradovich, opinion editor with the Des Moines Register, and we're here for an interview with Dr. Andy McGuire. She's one of 6 candidates for the Democratic nomination for governor. The winner of the June 5th primary will face Republican Governor Kim Reynolds in November. Andy McGuire, welcome to the Register.
Thank you. Appreciate you having me.
And in the room with us, our Register editors and reporters will go around the room and have you all introduce yourselves.
Carol Hunter, executive editor.
Brianne Fonensteel, reporter.
David Shivers, president.
All right. I've done several of these already, and we're asking everyone to start by just introducing yourself, telling us about your qualifications to be governor.
Well, I'll tell you a little bit about me. So I'm from Waterloo, Iowa. I'm from a family of 8. My dad was a World War II vet, and he came home. I was a fighter pilot. Came home and started a construction machinery business. My mom stayed home with us, and I have 5 brothers and sisters. And what I remember, and the reason I tell that is, what I remember the most was learning about caring about other people. If somebody was sick, like a neighbor was sick, we took over food, make sure they got back on their feet. If somebody was on their luck in our community, we made sure we got around them as a community and got them back on their feet. So I remember that caring, and frankly, that's why I became a medical doctor, was because I could see the power of caring about another person, especially when they're sick or injured. But I've been going all over the state, all 99 counties for the last couple of years, and I've been listening to people. And people don't feel that caring quite like I think they wish they could, especially from their government. They feel like they can't get ahead for their families. They feel like they're not really getting a fair shake. And honestly, I think they feel like I hear this all the time, the government is putting profits ahead of people. Well, as a doctor, I always promised, I took an oath to put patients first. I will always put people first, and I think that's what we need in our governor, someone who will make sure that every Iowan feels like they can be the success they want to be. So that's why I'm running for governor, because I want to change the direction we're going right now and make sure that every Iowan feels like their government is trying to care about their success, to care that every Iowan, and I mean every Iowan, and I say that for a reason because there are all different people in this state, and I want to make sure every one of them feels like they can be a success under my administration.
What do you think is the most urgent problem facing the state of Iowa right now? And as governor, what can you do about it?
I think it's health care. And I don't know that I always thought I'd say that, but when you listen to people all around the state, you even listen to the other people who are running, health care is what comes up. And as a doctor, health care is a right, not a privilege. And we say that, and I think we kind of walk past that statement. If you or any one of us could need health care this afternoon, and I want to make sure that it's there for you, so it's accessible, that it's quality health care, and that it's affordable so you can actually go have it. That's what that health care is a right, not a privilege means. And right now, certainly with our Medicaid, we're putting 600,000 plus Iowans at risk for having access to health care. And I hear the stories, and I will compliment you. I think the Register's done a good job of talking about some of the problems that have happened with Medicaid, but I hear these stories over and over, and really over and over. I'm surprised how I keep hearing them. And I heard about a special dad who has a special needs son, and he has been keeping him at home. The family's been helping. They had about 2 hours of Medicaid help a day. That's best for the patient, and always better to be at home than in an institution. It's good for the family, it's fiscally responsible, and yet as the MCOs have come in with this privatization, they have taken away now an hour every day. So then they thought, well, they could still do it. Well, now they're going to go to every other day. And they just don't think with their jobs and everything else, they can keep that child at home, so they don't have to put him in an institution. That's not caring about every citizen, and that's happening all over the place. It's also not fiscally responsible. It's not as good a care for the patient. It's not good for the family. It's not fiscally responsible. It's much more expensive to have him in an institution. And yet this is the kind of mess that we've gotten ourselves into. I also talk about, I have a friend who has a daughter who's disabled, and she has to drive an hour and a half to get her disabled daughter health care. And I thought, well, maybe she was a one-off, The other day I told that story, and down at Scenic Route, right here in Des Moines, and a kid came up to me and said, was that my mom? Because my mom has to take my sister an hour and a half to get health care. So, and that's twice a month. So just imagine those kind of problems. So I do think that healthcare and Medicaid and mental health and many other things are really the biggest problem we have right now.
I'll ask you about solutions, but first I wanted to ask you, I mean, you've worked in healthcare management, so what insight do you have about what is going wrong that maybe isn't obvious to everyone else who hasn't worked in this industry?
Well, and for those who don't know, yes, I'm a doctor, and then I was a healthcare executive. I ran a voluntary Medicaid company, so I'm very familiar with how this works. Here's the start problem, is they didn't ask anybody, and they didn't know what they were doing. So they didn't have the expertise to change Medicaid, and they didn't ask anybody. There should have been hearings. This is about 600,000 Iowans. This is about a fifth of our expenses for the state, and yet we didn't have hearings. We didn't talk about this. We didn't have the legislature be a part of this. And also, they tried to do it in way too short a time frame. As someone who's worked in Medicaid, there are other states that have done this, and that was one of the things that they said when they did this. They said 38 other states have gone to managed care. Not like we did. We did every part of Medicaid, and as you know, there are many parts. There's moms and babies, there's disabled, the mental health component, there's long-term care, very different parts of Medicaid. Most places do voluntary first for portions of that and get the network set up and get people comfortable, and then they go to a mandatory for maybe just the moms and babies. Long-term care is usually one of the last things they do. We did everything, and we did it in 4 months. And we did it with the idea of saving money. What you should do is look at this as you can be fiscally responsible in the long term, but in the short term, if you're going to say you're going to save money, I think they said they were going to save $50 million in the first 6 months. If you talk like that, that means you're denying services. It's the only way you can do that. Because the way you do managed care, and I have done this, and I don't want to talk too long, but it is what I do for a living, is you do managed care is you invest in people's health care. So you do preventive care. You make sure that they stay healthier. If they've got diabetes, you make sure they get it under control. So that takes investment. So you actually pay more at the beginning of a managed care cycle. And that's what we did when I was running my Medicaid, voluntary Medicaid company. We invested, we doubled prenatal care, we doubled immunizations. And what that does is that you spend a little more money at the beginning, but long term, which is what we ought to be talking more about, is long term. Long term, you will save money. For instance, you know how many immunizations or prenatal visits you can give for one NICU that cost hundreds of thousands of dollars, or one person who goes in the hospital and it's so expensive? You can pay for a lot of preventive care if you can prevent that in the long term, and you can. We were doing that. But that's not at all the setup that they've gone under.
Have you ever in your career had to say to somebody, look, I know that you want this healthcare service, but it's wasteful, it's not efficient, it won't work for you? Have you ever had to say no to somebody who wanted healthcare services? You know,
I ran case management, so lots of times what we did was said yes to things that might not have been covered by their contract because long term they were a better idea. People who were falling, and so you'd get them some structures in their bathroom to help them so they don't fall. That might not normally be covered by health care, but if you do that, you prevent a fall. That's a fall where they break their hip and they're in the hospital. We did more of that to make sure that we were actually getting people the care they need. I'll be honest with you, there's some care that people probably want that I remember a person who wanted a car instead of a heart transplant. That probably wasn't going to work. But for the most part, you talk to people about what is medically appropriate. And so I've certainly had those conversations with people, but you've got to make sure that you're looking at this from the patient point of view. As a doctor, you've got to put the patient first. And then you have to worry about providers. And one of the things I don't know that we talk about enough, we talked to Lutheran Services up in Waterloo. They're almost $1 million behind on payment. They cannot sustain that. You know, we talk about having small businesses, in economic development, and yet physical therapy, home health, those are small businesses that are not getting paid, and so they're having to, they're actually closing some of their doors in rural communities. We need to think about how we need to keep patients first and keep them healthier for the long term. We need to pay providers, and we need to be fiscally responsible, and that has to do with that preventive care.
So if you're elected governor, do you end the contracts with the MCOs and bring it back under state management, or what do you do?
You know, because it is such a mess, and because we've got patients at risk, I do think you take it back into the state. What you do then after you stabilize it, and I have the expertise to do that. That is not an easy thing. And we can't, you could have good intentions, but you could make that as bad as putting it into the private. So we have to make sure that we get people on the ground in to talk to them how we do that. We put patients first, and we make sure that we do that transition appropriately. Once we do that transition and we stabilize it, then I think you start talking about how can you make it better. And we can make it better. We can make it, we can do more preventive care and stress that so that long term we can have a much more predictable spend on Medicaid, because that is something you have to take into account. That's how supposedly we got here, though I would tell you our spend was not that bad compared to many other places. But we've got to make sure we're trying to equalize that out and make it a fiscally responsible. So, but I think how you do that is by keeping people healthier and doing the preventive care, and that will long term help you. And you also start with people who moms and babies is probably the easiest place to start, making sure you have prenatal care, making sure you're keeping kids safe, and you don't start with the long-term care and with disabled, which is one of the unfortunate parts of putting everyone in, that we should not have done that.
Overall, healthcare is becoming more and more difficult with the federal government rolling back the Affordable Care Act. Some of your Democratic colleagues or opponents, whichever you would choose to label them, are talking about Medicare for all, and regardless of whether the federal government participates or not, the state going it alone on Medicare for all. What's your position overall, maybe the longer-term vision for healthcare for Iowa?
Well, you go back to the premise that you have to have affordable, accessible, quality health care. What I see is making sure that everyone has that. I want the goal to be the goal, not a certain lingo of we have this program or this program. What I want to do is make sure we have our insurance industry is appropriate and is doing the right things. Right now we have an individual insurance market that is at risk, I guess what I would say, as one player, soon to have more. But I think we need to talk to them about how we can stabilize that, because the rates right now for individual insurance are making it so that we're having people drop out. So there's one part of it. We have to make sure Medicaid is stable and doing the right things, and our extension of health and wellness. We have to make sure that we, the people who are not insured right now, which certainly has gone down, though now it's gone back up because of some of the things that are going on, we have to make sure we try to figure out how to get them covered. Who are they, and how do we get them covered? Some of that is getting into some programs they don't realize that are available to them. But the other thing is making sure that if we need to, that we go to a private option or public option. I think it's something we should have done with the ACA originally. I'm sure there were political reasons we couldn't, but I think you have to have something, if it's a buy-in to Medicaid, or is it just a public option that we work out. I think you have to have some kind of public option for people to stem that gap. And then what I do is...
Are you talking about at the federal level?
No, I thought at the state level.
At state level. All right, so how do you pay for that?
Well, you're already paying for it. I explained to people, there's a healthcare pie. So that person who doesn't have insurance right now, who you might put into that public option, is getting care right now. They're going to the ER because they have a cough and they have lung cancer that's advanced. If we can get them to get their preventive care because we have them with affordable, accessible, quality health care, then you pick that up early and we can, first of all, save their life, but second of all, keep that amount that we pay under control. So you're already paying for it. They're already going to come, but it's an inefficient manner, and it's more expensive. So I think right now we're already paying for it. That pie is already there. What we have to do is figure out how to take that piece of the pie and make it more efficient and make sure we're getting those people preventive care. Isn't
that something though where again you're seeing the savings over the long term, but you're going to have to invest more money up front?
Yep. I honestly think you have to invest to get there, and I think it's something we don't do well as a state. I think we think about 6 weeks down the road, and I think that's a horrible way. As someone who's run a business, you cannot run a business, you certainly can't run your health care looking 6 weeks down the line. You have to look 3 and 4 and 10 years down the line and say, how are we going to be sustainable at this? That might take an investment at the beginning to get to where you actually can be sustainable. I don't have any problem with doing an investment that's an investment in health. And I think what you can do is work with the people here. One of the things I also think we didn't do well with this privatization was we have 3 out-of-state companies. We used to do overhead for Medicaid at 4% for the state. We now do it at 12%. You can do the math, but 8% of almost $5 billion is going out of state. I think if we take that and we start to work with our hospitals here, with our health systems here, with our doctors in Iowa, try to keep that money in Iowa and partner with our healthcare systems and our doctors and our providers to say, how can we keep people healthier and be fiscally responsible? That's sort of, the term would be a value-based system, but we can do that. I talked to a hospital, I talked to Henry County yesterday, and they're right now, because of poor payment from Medicaid, they're in the red. And they don't know how long. And they're symptomatic of how long they can stay in business being in the red.
Hospital.
It is. Yeah. But there's public hospitals, there's ones that are in systems, but our rural hospitals, you know, they estimate anywhere from 20 to 30 rural hospitals could close if this Medicaid decreased payment keeps going, certainly if they took away the ACA. So we have to think about that when we're thinking about all these other.
Could you put a finer point on the investment that it would need for the startup costs? I understand the point about long term, but are we talking about another $1 billion?
Oh no.
$500,000?
Oh no, because you're talking about a segment of the population. It's a small segment. And thank goodness, because of the ACA, we're at a small segment that's uninsured. Of that uninsured population, parts of it should go to health and wellness, should go to Hawkeye, but for one reason or another don't. And so what you need to do is carve that down. It's a small sliver that then you could say, okay, I think that this sliver, if it can't get covered with what we already have, then we may need a public option. That's just something I would do if I couldn't get that covered any other way. But no, I don't think it's at that level. And I think long term, you're talking about more stability and savings.
And so you wouldn't spend extra money to get have the state spend extra money to get prenatal care, to get some of the preventative things?
Well, right now, I mean, the nice thing is right now, prenatal care is basically covered because Medicaid goes up to like 400% of federal poverty levels. So those are covered. And some of when they did the ACA, if you take the pie, they did shrink it a lot by doing health and wellness, which was the extension of Medicaid. So this put in a lot of people who weren't eligible before. You've still got this 3 to 4% that are not insured according to our statistics, but Hawkeye could take some of them. Health and wellness probably needs some of them, but they're not signed up and in there. What I would look at then is if we have 1 to 2% or something that really can't get any other option, or as an option for people who can't afford an individual insurer. And what I'd rather do is shore up the individual insurance market. But if you can't, then I think we need an option for those people so that we can get everybody affordable, accessible health care.
We've talked about the healthcare pie, but the bigger pie is getting smaller. The legislature this year cut the budget, but we have a $7.5 billion budget roughly, and the income tax cut is roughly $400 million a year for the next 4 years, and then if revenues grow, then up to $600 million a year going back in tax refunds. So. Do you think that the state can sustain that? And if not, what do you do about it?
Well, I kind of look at history here. When the last Democratic governor left, we were $900 million in the good. And now we're every other month, it seems like, being $100 million, $200 million off of what we have and behind. So I see some real mismanagement there. And I think it's certainly not in our best interest, and maybe I'm just good at math, but if you do the math and you're behind and you're over budget and then you cut $400 million out, how do you do that? I would not have done that. I would not have said it was time for that tax cut. Tax cuts are fine if we have the money to do the services we want to do, but we're over budget and from that mismanagement, and we're not paying for the services we need. And of course, I think part of that is we're giving a lot of it away with tax credits and tax giveaways before it even gets there. I talk to people all the time about, I don't know that we have a revenue problem. Our revenues go up every year, but we give it away before it ever gets to the priorities. So I don't think we have a revenue problem. I think we have a priority problem. The other thing that just came to me, it was just yesterday, and I was on the road and in southeast Iowa, and you know, we talk about the mismanagement and these cutbacks, and we know they cut services. And this mismanagement we talk about on a higher level. Yesterday it came home to me that they were talking about they have a cut to services that they just got, and they have like 6 weeks left on their fiscal year. How are they supposed to do that? I mean, that money's already spoken for. So they dig into some philanthropy, and some people have given, and they push things together. But this is affecting real people. This was about transporting kids to Head Start. So how do they pay for the gas when they just got this cut? sort of out of the blue, if you will, for a 6-week period until they can get to the next fiscal year. You can't do that. That's hurting people. So this kind of mismanagement isn't just about these numbers, but it's about real people that are being hurt.
You can't go back in time to change that. You become governor in January of 2019. This law very well, likely will be on the books. So what do? Do you repeal it? Do you look at other revenue sources? What do you do?
The first thing I would do is not look at it in a vacuum. I would look at it with all the other sources of revenue and our expenses. Like I talked about, I think we do give away a lot of things in the tax credits and tax giveaways that are not giving value back. And I always caution people, there are some tax credits that are really good, so I'm not in kind of a blanket no more.
Which ones would you keep?
You know, we should look at all of them. But there are some of them, I think about, there's some scholarships, there's WIN credits that have really done what we wanted them to do. So what I would want to do is look at every one of them with the idea of, I give you $1, you know, this is how we first did the tax credits. I give you $1, you give me back value that's 10 times that amount. Is every tax credit we have, are they giving us back that value? And will they continue to do that? Because that's one of the things I've noticed is they might have said they were going to, but we don't check it down the line. We should be checking it all the way along. I guess the scientist in me comes to, we should have metrics and accountability on where are they doing, are they still returning value? You know, you might have a great idea. It sounds terrific. Everybody thinks it's great. We give you a tax credit to do it. It's going to bring great value. It doesn't work quite like it was supposed to. That happens in business. But we should not keep giving you our money. We should put it somewhere else where it can give us value. So that's the first place I'd look. But I think you look at everything. Like I said, I wouldn't have done this tax cut, but I would look at it in the whole scheme of what are our revenues and what are our expenses, and then what do we need to do to make that happen. I think that's what leaders do. So I wouldn't want to say, piecemeal, I do this and that. But we have to have enough money to take care of people. As I started at the beginning, this is about caring about people. What we're doing with Medicaid, what we're doing with mental health, what we're doing with women's health, what we're doing in clean water, what we're doing in the DHS that doesn't have enough employees to basically take care of our citizens. We need to have the services we need, but we also need to be fiscally responsible. And I think that's a whole package and not just one thing.
What's your vision for education?
Well, I wouldn't be here, and I'm sure most of you wouldn't be here and be successful if it weren't for education. I think it's the great equalizer. It's where you can say to any child, anywhere, that if you get into public education, you can be anything you want. And I always think there's a cure for cancer sitting in some 4th grade room right now, and we have to make sure that we have the best public education we can. How that starts, I've done a lot of work in early childhood, and I think it's important we start there. I did some lectures about early childhood and brain development, and you know, right now we spend a lot of money at the end of life and not as much at the beginning of life. And what I would tell you is, and I'm sure you guys know, but there's a study called the Perry study. There's a lot of childhood studies, but the Perry study is probably the most conservative, and it says for every $1 you spend on early childhood education, you will get $7 back. That's a pretty good return on that money. Again, it's to this preventive care. You have to invest to actually get the long-term benefits. Not to mention that if every child is ready to learn when they hit kindergarten, that helps every child. I talk to moms sometimes and they say, well, my child already knows all the things they know. Well, but your child's teacher is going to spend time with the child who doesn't know. So if we have every child ready to learn, I volunteer at Oak Ridge, which is a housing place here in Des Moines, to preschoolers. I read to 3- and 4-year-olds at preschool. And their results in 3rd grade, because we've been doing this a while, they're 10% better than the other kids because they've seen books. You know, some kids, they've never seen a book. They don't know. We talk about the title. We talk about the author. We talk about what words and letters are. We get them ready so they're ready to learn when they hit kindergarten. That is so important for what you do down the line. Then you got to talk about K through 12.
Before you leave
okay.
Early childhood, so are you talking about universal preschool, or what is the?
I do think we, a group of us advocated for the 10 hours we have now voluntarily. I think yes, you should have you should have preschool because I think it helps everybody everywhere. And I think as we're ready to learn going into kindergarten, it will have benefits long term, like the Perry study talks about. And then K through 12. Mike Gronsdal is a mentor of mine and a supporter, and he talks about since 1973 when the SSA went in until the last 8 years, we funded K through 12 at averaged 4%. Average. Now, you know, the farm crisis was in there, there were a lot of things in there, lean years, good years, averaged over 4%. We, for the last 8 years, have averaged less than 2%, and honestly, we're going towards 1%. You can't do that long-term to your schools and expect to have world-class education. So I think you've got to, you know, of all the places you have to put money and invest, this is probably the priority, is you have to invest in world-class education, which we have not been doing. I also think you have to work with the teachers on innovative ways that we can make education even better. But as long as they're worried about whether they have enough paper to do a test, they're not going to be thinking about ways to make education even better. And then I think you have to talk about higher ed, which is we've been cutting our Regents universities, we've been cutting our community colleges, and you can't have the world-class workforce we want and cut those. You've all seen the graph, but the state amount that goes to our universities has just gone like this. And I try to tell people, these tax cuts that you were talking about, what are people getting back? $167 I saw on one. Do you know how much tuition's going to go up for that $167? So if you have a child in college, you just gave back all that $167 and more. Now talk about the child who doesn't have the resources to do that. You've now priced him out of her out of college. Or she's going to have so much debt that she won't be able to really do this. And this is something I think for rural development. I have a mental health plan on my website if you want to go look at it. It's 17 pages, so I don't print it because I like trees. But if you go look at that, I think we should be doing more to repopulate our rural and hit college affordability and debt. So let's say your child says they want to go into social work. Well, first thing you're going to say as a dad is, well, social workers don't make, you know, the biggest money in the world. But this person really wants to take care of people. That's a passion job, I call it. But you say, gee, I'm your dad, and you're not going to be able to pay back your loans, so that's not a good idea. Well, what if we say to them, you go to college, you do your work, you get your loans, you spend 5 years in, let's say, Iowa Falls. I would say an underrepresented place for social work, but honestly, almost all of Iowa is underrepresented. You go to Iowa Falls, you practice for 5 years. We need mental health providers everywhere in Iowa, and we will forgive part of your loans as either just a state or a state and city. It may be both. And so, but it's part of your loans. It's not all your loans, because I do think you have, I don't believe in free. I believe in having some skin in the game, but not enough that it stops you. So this would make it, and you know what? If they go to Iowa Falls, they're going to love the coffee shop. They're going to make sure that they meet a guy or a girl. Odds are they're staying in Iowa Falls and building a life there. That would help our rural. It would help college debt. It would help with some of the professions we need in our rural communities. And I really think it has a long-term impact on what we want to do in Iowa.
The environment, the voters approved a 3/8 cent constitutional amendment, 3/8 cent sales tax for conservation and the environment. It has not been funded. Would you advocate for that? Would you push for that 3/8 cent sales tax increase for the environment?
I would, and I'll tell you why. I think it's a public health issue, but it's not because of what I think. It's because 63% of the voters said they wanted to do this. Now, I do worry by the source of the funding. I would love if the funding came from a different way than sales tax, because I do think that's regressive. But what I'd like to do is see if there's some way to work on maybe an earned income tax credit or some way to blunt the effects that would have on poorer people compared to people with more means. But I do think when 63%, that's a lot, when 63% of the electorate says something, you should listen. I've learned to listen as I've gone all over Iowa. You should listen to that. And we do have a water quality problem. And we do need those resources to make sure. I always say I'm a scientist. I'm a chemist by training and then a medical doctor. So in science, you need to know where you are. And that sounds so easy, except we've got to measure and know exactly where we are. We've got over 100 or over 50% of our waterways are impaired. We've got to know exactly where we are. Then we've got to know where do we want to be. And then we've got to get everybody at the table. And that's something right now we've got this adversarial way going on. We've got to get everyone at the table and say, okay, all of us are sitting down and we're going to get metrics and accountability between where we are and where we need to go. And I do think having that revenue source would help us get those metrics and accountability to get to a solution.
Some have argued that if you're going to go for a 3/8 cent, why not go for a penny and use some of the sales tax money for other priorities, perhaps such as mental health. Would you agree with that, or would you say, no, it's too regressive, we should do it some other way?
Well, I'd love to do it another way. But again, I go back to, I think you look at it as a package. So you look at what are our revenues coming in now? What are the expenses we have or we think we need as priorities? And then do we have enough revenue to get to where we want to go? I really do think there's a lot of revenue sitting in these tax credits, but I would want to make sure of that. And then I think as you get that and you get whether these tax cuts are what their impact's going to be and where your revenue is from, if these tariffs come in, we're going to have a lot different revenue than we think we're going to have. So I think you look at the whole package, and then you have to look at what revenues you need to do the expenses you want. So I wouldn't say I wouldn't or I would, but I do think there's a regressive tax. So I think whatever you do with a sales tax, you then have to make sure that you're not, at least as much as you can, adversely affecting the lower incomes.
You've got conservatively $150 million in tax credits that there might be some will to get rid of. The upper scale of that is about $400 million, knowing that some of those things there's just absolutely no will to get rid of those sales tax. Is there any way that you're not going to be more revenue than that? Looking at, you've already cut the income tax $400 million a year. If you get, say, $200 million, you can say you get $200 million back. You're still $200 million in the hole now from what has been spent.
This would be like me looking at you the first time as a doctor that I see you and going, I think you might have a couple of these things. You would never say what you were going to do by that. You would say, no, we need to look at them. I mean, some of these tax credits, too, they are 4 and 5 times what we thought they would cost. So I think sometimes we have to look at them and say, that might have been valuable at the original estimate, but is it valuable, the consumables for manufacturing, I think, is it valuable at the present amount it's that we're giving? So I think there may be more money than you think, but I do think it's something you have to look at everything in a package. And I'm willing, we have got to take care of people. And I'm a fiscally responsible person. I have a master's in business administration. I do know how to balance a budget. I've run a company, but I think you have to look at it in whole and not as pieces.
Let's talk about workforce development for a minute. The legislature approved the Future Ready Iowa Plan, which is aimed at skills training that generally would take less than a college degree, although the overall goal was 70% of Iowans to have some post-secondary training by, what was the year, 2020, something like that. So where would you put your priorities on workforce development? Are there things that the state is doing now that you would want to stop?
Want to stop? No, I'd like to do more. I've been to a lot of community colleges, and I think community colleges are a real key to this whole workforce issue. I'll tell you, I've seen small manufacturers in small towns. I don't know if you've driven as much as I have, but if you drive around Iowa, you see small manufacturers. If you talk to them, what they say is that they're doing fine. They're making a product. One guy makes he makes part of the grain bin, the chute that comes out. I said, could you make other products? He has a foundry and everything. Could you make other products? He says, oh, absolutely. He goes, frankly, they sell in Mexico, China, Canada. They say, well, yes, people want our products. They wish we'd make this. It breaks all the time that this one guy makes it. Great. Why don't you? Well, I don't have the time to build out. I don't have the time to hire. They're a small business. If we can match those up with community colleges, they have people right there that they could train. They can help build it out. That would be great experience for the people at the community college. And then they can help them hire people right in those communities, which I think that kind of organic growth is where we want to go. So to your Future Ready Iowa and the workforce, we do have to have that workforce trained, but we're doing this right now. If you talk to any community college, they will tell you they're partnering with their businesses locally. It's not the same at every community college. It's different, and it should be, because locally I have learned one thing Absolutely, as I've traveled around Iowa. One size does not fit all. So the manufacturers in southeast Iowa and the community college there, they're working with each other to make sure that they can have those kids trained for those jobs. Those are good paying jobs with good benefits right in those communities. So I think we're already doing this. So what do? We cut community colleges, which means a lot of those programs are going to be cut. They were working, and they are honestly doing what we were talking about doing over here in Future Ready, Iowa. So I don't have a problem with where she wants to go. I have a problem with why she's reinventing the wheel when the wheel is already really rolling right now. We should be investing more in those, and we shouldn't have it coming from Des Moines. We should have it coming from southeast Iowa. We should have it coming from the manufacturers in southwest Iowa. That communication between those two is absolutely doing a great job. And I would even say some of them are going into the high schools and getting some of that training before they even graduate so that kids really see a future in what they can do. There are so many good programs going on, but we're cutting community colleges. So I think it's like out one side and out the other. You can't cut community colleges and then say, but we're going to have this new program. Why would you do that? Go with what's being successful right now. So I would invest in what's actually being successful right now with the community colleges.
There's been some argument that even with increasing community colleges, that we just don't have enough people to fill the jobs. I mean, do you feel like Iowa needs to have a strategy to just actually bring in more people?
Well, first, I think we need to keep the ones we've got. And I think if you have good paying jobs with good benefits all over Iowa, if you have good health care, if you have good education, if you have clean air and clean water, those kids are going to stay here and their grandkids are going to stay here. That's the first thing you need to do. I do think if we had better infrastructure, I would call it, but broadband everywhere, we could keep people here that go off to Chicago or Denver. You know, my daughter came back here from Chicago, and she knows so many people who they telecommute to their jobs. So they may go in once a week or once a month, and they're otherwise in Chicago. And it's not the greatest place on earth. We're the greatest place on earth. We have the quality of life. We have the cost of living. They could live right here and go into Chicago once a month and have all that. We should be talking to people about that and repopulating with that. It's interesting. I was in Cherokee, Iowa, and I said that to a group of people, and this gentleman goes, "They told you about me, didn't they?" And I said, "No." And he said, I work in San Francisco and I live in Cherokee. So, but we've got to get good broadband so that they can do that. But I also think we need to be a welcoming state. And I think we need to welcome new people into this state. They may not always even look like us, but we've got to be a welcoming state. We have a history of doing that, and we have gone away from that history right now. And I'll tell you, Denison is a thriving community. I don't know if you've been there lately, but they're over 25% Hispanic, and they're doing great. But they're very nervous because of the kind of oppressive nature of things right now in our government nationally and in the state. So we need to be more welcoming state, because what do immigrants want? They want the same thing we want. They want to do better, they want to work hard, they want to do better for their kids, raise their families. We should be a welcoming state.
What does that mean as far as policy is concerned? Roll back sanctuary city laws? What does it look like to be a welcoming state when it comes to public policy?
Well, I think some of that is national or federal, and I don't think you can do anything but be on the bully pulpit to say that we are a welcoming state. But some of the things we've done lately where we're using local resources to help federal, such as the ICE raid down in Mount Pleasant, I don't think we should be doing that. And we don't really have sanctuary cities, and now we've done this law that says they can't, they have to help. I don't think our local officials should be helping with a broken immigration system, and that's what this is. And what I would advocate as governor is that we, at the national level, we need to have a true, comprehensive immigration reform that keeps families together and that get a path to citizenship. We need these people. We need more than these people. And all they want is the same thing we want, is to work hard and be good citizens and help raise their kids. So I think it's more the bully pulpit because so much of it is federal, but I do think you can certainly put out the welcome sign, and we're right now putting out the closed for business sign.
Do you think the fetal heartbeat bill plays into that comment you just made in terms of being a welcoming state or not being a welcoming state?
You know, it certainly is extreme, and Iowans are not really known for being extreme. We're Midwesterners. We're not known for that. This is the most extreme anti-choice law in the nation. I've had colleagues of mine call me from, one from Indiana, and he said, you know, we're usually the ones, and now you're the ones. And I just think it says that we don't trust women. I think it says that we have extreme policies towards women. And it won't, this won't, I don't think it'll be found constitutional anyhow, but it won't decrease abortion. It won't. All it'll do is hurt women. It'll get between a doctor and a woman, and abortions will continue. They just won't be safe. So that's the problem here. If I was on an initiative to decrease unintended pregnancies, it was Sally Peterson and Christy Vilsack, and I was on the board. And what we did was we had affordable, accessible birth control, and we marketed it to young women so that they could decrease unintended pregnancies. And you know what happened? Birth control, we had great metrics. Birth control usage went up and abortion went down. That's how you have fewer abortions. And I would love to have fewer abortions, but this bill is just getting between a doctor and a patient in a medical problem that she has that could cost her life if it's not a safe procedure. So I don't think this is something that certainly tells women they should come to Iowa.
If the bill goes, if for some reason the bill is upheld, would you be working for a repeal if you're governor?
Well, I would have vetoed it if I'd been governor at the time, and yes, I would work for common sense policies about women. This is not how we get to any solution here. This is extreme and hurts women.
What would you consider common sense policy when it comes to abortion?
Well, I think where we were 2 years ago was pretty common sense policy. It left
so that would be before the 20
before
week.
the 20 week. It left the decisions really between a woman and her doctor. What people don't understand, and I guess as a doctor and as a woman and as a mother of 5 daughters, people don't understand that these situations are very complex. And so for somebody to say, I'm going to understand everything about your problem you have, all the insights you have, I'm going to understand from a place very far away for everybody. One size fits all. That doesn't work in these situations. I've seen these situations. They are very complex. And so you cannot decide from afar for that woman, for what she needs to do. You cannot do it. And so that's what we're trying to do. It will not work. People will still have abortions. They just won't be safe.
We talked a little bit about the policies of Governor Reynolds. I'm wondering if she's done anything that you agree with.
Well, I think some of her intents are good. I think the mental health bill, I've been very proud of and talking about mental health, substance abuse, and addiction since the beginning of my campaign because it's personal to me, and now everyone is talking about it. I'm not sure I was the only one who had to do with that, but I'm very proud of that we're all talking about it. She's talking about it, and she did put this bill. They passed this bill, and it's a good step. It's a good step in the right direction. The problem is that the funding for it is tenuous at best, if any, and so then it becomes a piece of paper. But honestly, she did bring it up. And one of the things I would say with mental health, substance abuse, and addiction, if you look at my health plan, my mental health plan, is the stigma. And at least by even bringing this up and talking about it, and talking about how we can have some suicide prevention, and we can do some more training, and we can have crisis centers, even without the funding, it has made a step forward that we're looking at this. We're all in this together, and we want to make sure this is treated as a disease. I talk to people all the time. We're 50th in mental health beds, 47th in mental health providers, and you talk to any sheriff, and they will tell you they're the first-line mental health providers. I still remember when the sheriff in Blackhawk County said, "You know the biggest mental health facility here?" And he pointed down the way, and it's the jail. That's not what we need to be doing. So I think the fact that she's brought that up and she's talked about it, I think there's a lot more to do than even she went as far, but I'd go even farther. But the fact she's bringing it up and trying to treat it as a disease, we would not put, if you had diabetes or a broken leg, we wouldn't put you in jail, and yet we do that with mental health, substance abuse, and addiction. So I applaud her for doing that, but I'm reserving some judgment that if you don't put funding behind it and it can't actually happen, then how good is it? I want to get to solutions. I don't want to just have pieces of paper.
What's the best way to fund mental health going forward? Right now, the bulk of it is property taxes through the county regions. Some counties, not all of them, but some counties are bumping up against that cap.
They are.
So do you raise the cap and continue to put more property tax money toward mental health? Do you bring state revenue in some other way? How do you do it?
I say in my mental health plan, I would allow localities to raise their cap. I would take that off so that if they wanted to locally, because they know best what they need to do for their own people, and I do think you should keep that at the local level.
Raise it to a certain level, or just take it off?
Take off the cap and let the local decide where they want to be. Our region, we came from the poorhouse, and that's how we got to this county, and now we've gotten to the 14 regions. It wouldn't be the first place I'd go to do something different than the regions, because it's not perfect, but it works. And what I would do, and I talk about this in my plan, is I would make sure there was more communication between the regions. We have some regions that are doing some very innovative work, and we have other regions that aren't doing quite as well. I would make sure there was communication between those regions more, and that we had more state centralized of, if this is working for this region, let's make sure everyone knows how to do it and that we can do that better. So I think the regions can work, and I think they can be funded, but I think you have to let the localities decide. I hear that everywhere I go. The other thing I think you have to do is, right now we have mental health and substance abuse and addiction run together. 70% of the time, very much a dual diagnosis. So right now, DHS does mental health, and substance abuse and addiction are done in public health. I would suggest we have a division over mental health, substance abuse, and addiction, so that we could bring those together and then have the regions under that, so that we could bring that kind of resource all together. The other thing, people talk about, how do you pay for mental health? I have a program that we talk about in my mental health plan, that if you have substance abuse or addiction, you're nonviolent, not a safety risk, that before you even get in the system, you go into treatment. So you don't even have the box, none of that, you go into the system. That system is 1/6 for that treatment, instead of going into jail, is 1/6 the cost, and it has 10 times the results. So right now we go, well, how do you pay for this? Well, right now we're putting him in jail. So it's costing 6 times what it would cost if we did it the other way. And you have 10 times the success rate. So honestly, when you ask how I pay for it, we're paying for it right now. And honestly, if we started these programs in the long run, and it's not very long, I mean, these are a year to 18 months, this is pretty quick. We could really have a substantial decrease in how much we were spending for that, and we can put that money right back into mental health, substance abuse, and addiction.
You mentioned, that you would go farther, and I think funding is a piece of that. But are there other aspects to the mental health system that would be your top priority to tackle?
I think a lot of what she suggested is good. I would go a little farther. She has some of the ACT teams in the crisis centers. I think those are good. I would want to make sure that we talked more about acute beds, tertiary beds or secondary beds, rehab beds, whatever you want to call them, and then tertiary beds are more long-term. And when I start to talk like that, you realize how complicated this is, and that's why I think someone with my healthcare expertise understands what we need to do here, because people talk about getting acute care beds. If you get 60 acute care beds, they will be full tomorrow, and no one will go out of those beds because there's no place to go. Now, if you can go home because you have that kind of situation, great. A lot of people can't. So then they have to stay in the acute care bed. I know Broadlawn's had a person who stayed over a year because there was nowhere else for them to go. So what you got to do is you got to think of the continuum of care, and I don't think we've done enough of that in this policy. So you get the acute care beds, you get a secondary bed where you don't need quite that care, but you still need some care, and then some people honestly are not going to be able to be on their own. And we have to figure out ways to make sure they're as successful as they can be, and that it's fiscally responsible. And there are ways to do that. And that's about caring about every citizen. And we have the facilities that we could make better, but we have to do that.
There's a lot of issues and not too much time left, but I did want to circle back a little bit to the environment.
Please,
especially as
that's the one I want to talk about.
Okay, good. Well, especially as it relates to animal agriculture and agriculture in Iowa. The nutrient reduction program has been voluntary. First of all, do you think voluntary is good enough? Does it need to have a mandatory aspect to it? And second of all, what you're thinking about the concentrated animal agriculture and that the future of that.
That's a big
in
subject.
Iowa. Yes,
Yeah.
yes, it is.
Well, first I start with being a scientist, being a chemist, and being a medical doctor. I kind of approach things from science, and climate change is something we don't bring up enough, and we should. Climate change is a scientific reality, and I talk to people all the time about bringing science back to their government, and I think that's a lot how we should be approaching clean water. It's how we should be approaching the CAFOs. We should be approaching them in a scientific way, and we haven't been doing that. So for clean water, I talked a little bit earlier about you need to know where you are, you need to know where you want to be, and you have to have the metrics and accountability to get there. I do think you need accountability. I don't think just voluntary is going to work. I think you need accountability. As far as the CAFOs, we have this master matrix that doesn't work. And I don't think it's something that can be tweaked. I think it needs to be blown up, and we need to start over. So what I would do is have a framework, and this is another thing you do in science. You have a framework of how you would work. The reason you have a state framework is because you don't want one county to be able to implement laws or rules that would impact another county downstream, if you will. So you have to have some state regulations on what you can do with the CAFOs. But the majority of what you do has to be local. We have to have more local control. The local control right now is not good, and we have to have that. But the science part is we're not doing enough research to make sure how, we're an ag state, but we want clean water and clean air, and I don't think that's an either or. I think that's an and the and is because we get scientific research. We have great regents universities, community colleges, or private universities. Let's incent, help us to figure out how we can have livestock, which is one of our industries, and how we can have clean water. I really think we're smart enough to do this, and I don't think we've been incenting that research. And I believe in research, that research can really show us the way on how we can be both an ag state and have clean water and clean air.
This is with 6 people in the primary. There hasn't been a lot of polling, but there are some candidates who have raised a lot more money. They've been on TV.
I'm on TV.
Yeah. And so talk to us a little bit about what you think your path is to the nomination.
Well, what I hear, and I'm sure you've heard it as people have come to the Ed Board, I hear the things people think are most important to do first in our government. I'm going to guess they talked about Medicaid and reversing this privatization. I'm going to guess they talked about mental health, substance abuse, and addiction. I've been at a few forums with them. I'm going to guess they talked, you got it. I'm going to guess they talked about women's health. I'm going to guess they talked about, just like we were, public health as far as like clean air and clean water. We talk about nursing home oversight. We talk about so many things that honestly are about health. So I've been a doctor and in healthcare my whole life. I've been an executive. I know healthcare inside and out. And it is not an easy field. It is a complicated field. And so I think that gives me very unique expertise and experience to do this job in a better way for those than anyone else. I've also had a lot of experience in education, which is the other part that I think comes up. So I think my experience really helps there. But the other thing I'll tell you is my passion. Nobody will be more passionate than I will. I have 7 kids and 1 grandchild, and I am passionate about making sure that my children and grandchildren and your children and grandchildren can stay right here in Iowa. How many times did we talk today about how we have to have certain things, we have to care about citizens so that our kids and our grandkids can stay right here in Iowa and be successful. So that's my passion. That's why I got into this. And I see a wonderful Iowa. We have all the opportunity to be the state I know we can be. We're just going in the wrong direction right now. But I see that Iowa with affordable, accessible, quality health care. I see that Iowa with world-class education. People move here for our education. I see an Iowa with clean air, clean water. I see an Iowa with those great jobs with great benefits everywhere. So I think that passion and then the expertise and a lot of the issues that are really at the forefront right now make me the best qualified to be governor of Iowa.
Are there issues where, like you said, you've been to 1 million forums, that you...
I think it's just shy of 1 million. But yes.
Almost 1 million. A little exaggeration there, but issues where you know that you just don't agree with most of your Democratic opponents, colleagues?
One thing we don't talk about probably enough that I feel really strongly about is voting. We've had this voting suppression bill, I would call it, in the last legislative session that really it shortened the time frame for voting and made it more difficult to vote. I would like to see it be as easy as possible for people to vote, because I think that's democracy. I think we want everyone to vote. And I'm not sure I've heard all the different candidates, so I don't want to quote them, but I would like to get all the way to mail-in voting like Oregon does. I think it's a good way, it's cheaper, it gets more people involved, and has very little fraud, though we don't really have any fraud here right now. So I think more participation in our voting would be good, and so I do have a more liberal view maybe on voting, that I think if it's a liberal view to think everyone should participate in our democracy, then so be it.
On voting, what would you do with the voter ID law?
I just think it's a suppression law, not a voter ID law. To me, we really didn't have any measurable fraud, and yet it was sort of a solution in search of a problem. We didn't have the problem. So I would try to, I don't like that bill, and I would try to get rid of that, but I would even go further to try to get more participation in voting.
We haven't asked a lot of your colleagues about this, but the ruling in New Jersey now makes the issue of sports betting a lot more urgent in Iowa. Are you in favor of legalizing that?
Well, I think I'd probably have a lot more people talk about it since it's just coming out, I think today or yesterday. But what I would want to make sure of is that we don't have any unintended consequences with doing it, and that communities got some of the resources and/or the state government, so that it's not just a profit maker, but it actually makes communities better, like we've done with our gambling. I was the head of the grants committee for Prairie Meadows, and we've done a lot of good with that money, and I would want to make sure if we did do this, that we took care of people who might have a problem, that we made sure we did it without the unintended consequences, but that a lot of it went towards community betterment.
Do you feel like the casino gambling and pari-mutuel gambling in Iowa is are you satisfied with the way that has been run and how it's going in Iowa?
There are a lot of good projects that have happened because of the community betterment from the gambling. That is absolutely true in many areas. It has also brought jobs to many communities that were hurting. So I'm not sure I think we should have more, but I do think we have to look at the good things that have happened because of the gambling revenue and the community betterment.
In Cedar Rapids, people have argued that the state has put too much of a limit, that they feel like it should be up to the community and not just a bunch of unelected board members to say whether they can have a casino or not.
I think the community might have a point there. I haven't looked at it close enough to certainly make any decisions. And the other thing I would do is I would want to listen to the communities, because I do think we don't listen enough. We make decisions in Des Moines. I can tell you I'm going to be listening to people and talking to people on the ground about what's best for their local places. And that includes a lot of issues, but it would include this one as well.
All right. Final question. Why should the Des Moines Register endorse you?
Well, I think we've talked a lot today about why that is. When you look at the issues that are at the forefront of what we're talking about in Iowa, you listen to anyone. I've been all over, and when you listen to people, they're frightened about their health care. They're worried about their friends and neighbors who have mental health struggles, substance abuse and addiction, and cannot get care. And frankly, we're losing people. We've got those 600,000 plus people on Medicaid that are really losing access to care, and we have to worry about them. We've got women's health that's now so extreme, it's unconscionable. So, and we didn't even talk about defunding of Planned Parenthood, which, if you're going to make birth control more accessible so you can have less abortions, you certainly need to fund Planned Parenthood. With all the different issues we're talking about, especially in the public health realm, I was the chair of the College of Public Health board down at Iowa City. With all the issues you're talking about, I think I have a unique expertise in so many of them. In the things I've done in education, I think I have a unique expertise. These are the issues I hear people talking about. If we don't have, people talk about economic development. If we don't have good health care all over Iowa, especially in our rural communities, if we don't have good education, we are not going to have people moving here. We're not going to have companies moving here. We're not going to have people starting businesses here. So I think that's the foundation. I think that's where my expertise lies as someone who's been in healthcare my whole life. So I think that unique set of expertise at this moment in time in Iowa, and my passion for making sure that every Iowan is successful and that your kids and my kids can stay right here and be successful in Iowa. I think that's the Iowa that we all need, and that's the Iowa I want to bring as governor.
Okay, Dr. Andy McGuire, thank you for your time. The 5 other Democratic candidates for governor and also the 3 Democrats running for the contested primary for Iowa's 3rd congressional district have also been meeting with the Des Moines Register editors and staff, and we'll have a few meetings left this week. We also met with the 2 Libertarian candidates for governor. See DesMoinesRegister.com for all of the videos of these meetings and also the schedule for the ones yet to come and for all the coverage of the primary and the election.